Taking vital signs is a crucial part of healthcare and is a part of daily routine of healthcare professionals. Having vital signs out of the normal range could indicate a series of problems, and having it identified early on, there is a higher chance of curing the issue. Taking vital signs may seem like a simple task, but some skills are needed in order to take vital signs accurately. I'm a pre-nursing student who studied nursing for a while in Hong Kong, so I have learned how to accurately measure vital signs, and that is what I'll be showing you today. Before we get into how to measure vital signs accurately, I want to inform you what the normal range of each vital sign is. The normal range of respiratory rate is 12 to 20. The normal range of pulse is 60 to 100 beats per minute. The normal range of blood pressure is 90 over 60 mmHg to 120 over 80 mmHg. The first number is the systolic blood pressure, and the second number is the diastolic blood pressure. And lastly, the normal range for body temperature is from 96.8 Fahrenheit to 99.5 Fahrenheit. So I'll start with how to measure your pulse. You will need a watch or a clock with a second hand. This is preferred over a digital watch, since looking at the numbers while counting your pulse might be distracting. So you're going to place your middle and index finger on the outer side of your wrist until you feel your pulse. Look at the second hand and start counting for 1 minute, and that will be your pulse rate. Next, I'll demonstrate how to measure respiratory rate. You'll also need a watch or a clock with a second hand. One respiratory cycle happens when the chest rises and falls once. So count how many times that the chest rises or falls within 1 minute using the second hand. If you're measuring someone else's respiratory rate, you could do this right after measuring their pulse and leave your fingers on while you're counting the respiratory rates. So, because if they're conscious about their breathing, this could affect the accuracy of the respiratory rate. After that, I'll show you how to measure your temperature with a tympanic thermometer. Okay, so it's best to use a new probe tip each time. Gently tug your ear before placing in the thermometer, and then press the button, and then that'll be your temperature. Lastly, I'll show you how to measure your blood pressure accurately. This is a blood pressure monitor. So I'm gonna wrap the cuff just over my arm, over the elbow. It should be 2 to 3 centimeters above the elbow, and make sure you're not wearing clothing that is too loose or too tight. You should be able to place a finger inside. And then another important point is to keep your arm at the same level as your heart. So this basically means to use a table that is not too high or too low for you. And stay relaxed and still and don't talk in order to get a more accurate reading. After this, I hope you get a better understanding on how to measure your vital signs in a more accurate manner and regularly measure them to monitor for any underlying health issues. Thank you.